the Biocade, and today we're going to talk about a disease that has claimed many lives over the years, and even today it is the reason for many thousands of fatalities in a year. Yes, guys, we are talking about cancer. Cancer in general is a large group of mostly life-threatening diseases that varies in their occurrence and characteristics. It is the uncontrolled growth of abnormal cells anywhere in the body. These cells are often termed as malignant cells. These cells can spread to normal body tissues, and the phenomenon is called metastasis. The four major types of cancer are there. Those are carcinoma, sarcoma, leukemia, and lymphoma. Carcinoma is the cancer of skin and other tissues that line other organs. Sarcoma is the cancer of connective tissue, such as muscles and blood vessels. Leukemia, it is the cancer of blood cells. And there is the lymphoma, which is the cancer of the immune system. Now let's come to the causes of cancer. Many things can cause abnormalities in cell growth and development. Some causes remain unknown, while others are caused by environmental or lifestyle changes. Many patients develop this cancer due to a combination of these factors: exposure to toxic chemicals, benzene, cadmium, vinyl chloride, or cigarette smoke, asbestos, etc., are very toxic and causes cancer. Exposure to ionizing radiation. Prolonged exposure to ionizing radiation such as uranium, X-rays, ultraviolet rays, etc. can also cause cancer. Exposure to pathogens. Human papillomavirus, Epstein-Barr virus, and hepatitis B and C viruses are being researched as possible agents for cancer. Signs and symptoms. Symptoms depend on the cancer and its location. Some of the symptoms include lump in breast, seizures, changes in bowel or bladder habits, sore throat, chronic indigestion, unusual bleeding or discharge. Now let's get to the diagnosis. Some cancers are being diagnosed during routine screening tests. Many cancers are discovered when you present to your doctor some specific symptoms. Most doctors will order a complete blood count and electrolyte levels to gain additional information. Imaging studies such as X-rays, CT scans, MRI scan, etc. are nowadays common, which may be used by the doctors to discover any abnormalities in the body. However, in all patients, the definitive diagnosis of cancer is based on biopsy, in which some tissue is removed from the tumor to discover the presence and extent of cancer. Cancer staging. Some common elements are considered in most staging systems. Some of them are the site of primary tumor, tumor size and number of tumors, lymph node involvement, and the presence or absence of metastasis. The TMN staging is used for most solid tumors, while stage grouping is used by some doctors and researchers on almost all cancer types. In the table on the right side, there is given the stage and definition of it. So stage 0 means carcinoma in situ. It means the cancer has not, spread yet. Stage 1, 2, and 3 indicates that subsequently larger tumor size, spread of cancer beyond the organ in which it was first developed. And stage 4, it means that cancer has spread to another organ, and this could be fatal. Is cancer prevention possible? It is the million-dollar question. Most experts are convinced that many cancers can either be prevented or the risk of developing cancers can be markedly reduced. Screening tests and studies of cancer are meant to help detect the cancer at an early stage when the cancer is most likely to potentially be cured with treatment. I hope you guys like this video, share it with your friends, and subscribe to the BioKid. Thanks.